Number 5 is, will there be any more updates regarding operations concerning the upcoming holidays and the gatherings that continue to happen?
My response to that, ladies and gentlemen, is yes. Each time we can get something new and improved to give you, we don't want to sit here and rehash the same old for you. We want to give you something new and improved. But we're here. We're watching. We want to, in case there's another wave or supercell of spreading. We are waiting in the foreground to present that to you. But I don't want to just come out and rehash, wash your hands, wash your hands, wash your hands, to the point where we're falling on deaf ears. But we're here. We're ready. As far as holidays come, we all know folks are going to gather. It's the holidays. Thanksgiving and Christmas, 2 biggest holidays for families in a year. All we ask is that you try your best to make it a safe gathering, a socially safe gathering. We don't have martial law, and we're not going to have martial law on the reservation. So, to think that we couldn't have Christmas would be ridiculous. But do it safely. And that's all we're asking, is that you make sure everybody washes their hands before dinner.
Not only that, but you got to look at the social gathering issue as well. And everything and anything we do. If you got it, our people, we need you to adhere to some of those things for your own safety and your own family safety. When you get a large gathering and you don't know the people that you're coming in contact with, you don't know whether or not they got a fever or what. You got to be very careful in your gathering. I believe it's still, only 10?
Well, Governor Sisolak's office here in Nevada just approved up to 50. That just came out last night.
Okay.
However, the tribe's stance is still at the CDC recommendations at the beginning of up to 10 people in a gathering. Well, we know there's some pretty big families here on the reservation. 10 is, but again, as people come to your home for the holidays, ask them, do you have a fever? Are you not feeling well? You can ask the same questions of signs and symptoms that we would ask if you were going to your doctor's office, and if they are having signs and symptoms, it's not being disrespectful to ask them to go home. Send them a plate, but ask them to go home so that you can take care of the rest of the family in a safe environment.
See, the tribal council doesn't want to, try to, as you were saying, impose martial law or, trying to, say, don't do this, don't do that. It's up to the families to decide how they're going to work through this. Right. And they have to, again, just follow those CDC protocols, making sure that, they're utilizing those best practices out there. So it's just, that's what we're just trying to put out there to the public. If you're going to gather, please be very careful, because this, like we've talked about before, does not just, it's out there and anybody can catch it, and we can be asymptomatic and be a carrier and not even know it and come into a gathering and, somebody could get exposed.
And I'm glad you brought up the term asymptomatic, Mr. Chairman. A lot of folks don't realize when we say asymptomatic, that means no symptoms. No symptoms, no fever, no coughs, no chills, no runny noses. But you can still have the COVID virus in your system. That's asymptomatic. Symptomatic is when you actually have a physical sign or symptom of the illness, loss of taste or smell, fever, chills, body aches. And these things can look very similar to influenza. So again, we would say, on respect for everyone here on the reservation, if you don't feel well or you think you've been exposed, please don't expose Grandma and Grandpa at Christmas dinner. Stay home. They'll understand. Okay.
Okay, here's number 6. Why hasn't there been an update regarding PPE distribution?
Well, and we've tried to do that with each video. We've let folks know that if you need personal protective equipment, and we only have certain amounts of it, you can contact the Emergency Operations Center, and you can reach us in a multitude of ways. One, you can contact the EOC's direct line, which is here at the reservation is 574-2425. You can call the fire department at 574-8999. The clinic at 574-1018 for like hand sanitizer and such. And if you need it delivered, they'll send it to us. We will get it out to you. You can contact the tribal headquarters office here at 574-1000. And they will see to it that the fire department receives the request of what you need. And if you aren't able to come and get it, just say so. We'll bring it to you. And there's always the website. There is a place where you can contact us on the website, both on the general website, the clinic's website, the fire department's website, where you can ask questions and send us your request. We're happy to get you what you need, but you have to ask. We have to have someone asking for it because we don't know what everyone's needs are. And we don't want to just give out all of our, we're not stockpiling personal protective equipment, but we are trying to maintain levels so that if a wave was to strike us, we are prepared. So we want to make sure you get what you need, but we don't want to just hand out everything when PPE is now available at stores and online.
Yeah.
If you need a mask when you go to a grocery store, they will give you the mask at the grocery store. I mean, and so on, or the doctor's office. They prefer you bring your own, but if you need it, they will give it to you.
I was talking to an individual just the other day, and they were telling me that we were saying, man, you know what? I went over to get some water, and it's just like the water's all disappearing all over again, and even the paper towels and all that, so. Everybody, I guess, is getting into that mode again of having to stockpile, and it from what I understood, of the PPE is, can we get in trouble if we stockpile too much of it at a tribal?
Well, I would say it's not so much that we get in trouble as it is we don't get the priority that we get right now. We collect personal protective equipment from both the state of Nevada stockpile and the federal government stockpile of supplies. When they find out, or if they find out you're hoarding supplies, then you fall from being up high on the list of receiving those materials to very low on the list. And right now, Pyramid Lake is very high on the list of receiving what we ask for, because we're not asking for crazy amounts of masks or shields. We're asking for realistic numbers, and that keeps us very high on that list, and we want to maintain that level for the safety and security of everyone we're here to serve.
Okay, that's a good answer. We're on our last question now, number 8. If a department goes down due to close contact COVID exposure, is the Pyramid Lake tribe community going to have to wait for services until the department opens back up? If so, why is there no alternative establishment in these and just in case issues?
Okay, let me answer that in a couple of parts. The first part being, when COVID initially became a crisis and declared an emergency, the tribe, like all governments, decided what programs were essential and which ones were non-essential. So in the non-essential category, those programs were closed and the employees were furloughed, which meant there was no one else was picking up that ball. They're just closed until further notice. With an exposure on the essential programs, we do have alternatives in place for those. Now, for example, when we did the meal deliveries, programs came together. Multiple programs came together, contracts and grants. They went out, made contact with Washoe County Meals on Wheels to secure the meals. Social services and fire got together along with contracts and grants. Once we got the meals and got them here, then we were able to distribute those out to the community as best we could. Now, again, we weren't the senior center, so we may not have done it as absolute and perfect as they do because that's their wheelhouse.
Yes.
But we did the best we could in a tight spot. We've helped out when maintenance went down with COVID, with picking up the food for the food bank and bringing it out to the reservation and helping that get distributed. Because our goal here with the EOC through the fire department and so forth, and all the programs working together, is to ensure that all of our tribal members are cared for and get the services that they need. All right, so that no one is being left behind. Is it a perfect world? No. If someone got left behind, we apologize. Let us know so we can fix it. But, you know, other programs that aren't necessarily non-essential but essential, for example, our housing authority is currently in lockdown for COVID. But they used the COOP plan, which is the continuity of operations plan that the tribe has to bring us up to speed in case something happens to a program so that the government doesn't just stop turning.
Exactly.
And so when that happened, they utilized their COOP plan, got out information so that you could pay your monthly rent or your house payment so that nobody goes without a home, or get a notification in if they needed repairs. It may not happen today, but it's in the queue so that no one gets left behind.
Exactly.
And it's important that we all continue to work together in our programs to overlap and help one another, help the people we're here to take care of.
And basically that's what we've been doing all along. You know, even though when the clinic went down a couple of times, you know, there were services that we could provide, like the dialysis.
Yes.
We were able to transport and do that. Anything that had to do with any emergency response, your team did go out there and work on it. As far as the fires too that happened not too long ago. So yeah, in response to everything, yeah, we were able to get out there and provide these services, ongoing services for our communities. So in all, we're still working this out. Winter's coming ahead. The clinic's looking at other alternative sites to where they can actually put in more services, like in the recent one was looking at Wadsworth, maybe putting a small clinic or something like that there, just in case they do have another exposure or whatever at the clinic. So again, we are moving ahead in these areas, and we're just like any other community. We're just working it out. We're working it out. I don't know about any other place, you know, that hasn't been doing the same thing we're doing. You know, we're working together, and that's the beautiful thing about it. You know, we may lag a little bit in some areas, but like getting more information out out there. But again, it's all been put out there. It's just that our membership needs to understand that, you know, there's platforms out there that we can put this media out on, and it's going out. So again, you know, we just got to work together, continually work together. We're also looking at the personal, maybe mailboxes out there. Somebody brought it up, something about what Reno Sparks is doing about putting mailboxes out there. We're looking into that as well, so that we can, you know, we're doing a drive-by instead of having to go up to the door and all that. We just slide it into those mailboxes there. But again, that's something that we're looking at. So everything that we're doing has to do with keeping our membership safe. Just the distant learning module that the tribe's doing for the kids and the families, giving out all the information that we can about COVID and the restraints behind it, about social distancing, masking up, wearing the PPE when you go out in public, and just being safe out there. That's all we can do. You know, we're not imposing martial law on everybody. We're just hoping everybody is using these safe practices, and that's all we can do.
All right, and we're building for the future.
Yeah, exactly.
Our program has just recently certified 7 more immunization techs in the fire department, so that when the day comes we have a vaccine for COVID-19, we'll be at the ready with hand in hand with our clinic to get those vaccines out rapidly and safely, and you know, make sure our community is taken care of.
And that's working alongside with the clinic as well. There's only one, as you see, he's still busy. We have also discussed on doing another community-based testing, and that one is going to be in the Wadsworth area. It'll be the clinic and the EMS working together with, is it the clinic or is it just the EMS and National Guard?
No, we're working with the clinic. We want their involvement. They are the experts.
Yes, they are.
In this. We're here just as a support mechanism to them. They have the doctors, they have the nurses, they have the expertise, and we have the boots on the ground to help them. But the ultimate goal is to work with a lot of places, the Guard, our clinic, and us, so that we can provide those services. The last time we had several tribal council people come out and help volunteer with the drive-through testing.
Mm-hmm.
Other community members came out and offered help so that we could get as many people through that day as possible, so that we know everybody's being taken care of.
Mm-hmm.
And you know, I think we're doing a really good job here at Pyramid Lake. The last numbers I saw, we only have 15 people
Mm-hmm.
on the reservation who have been in quarantine or home isolation. We don't have any in the hospital for COVID right now. We've been very fortunate. We've had no more deaths, which is great. And I mean, we're doing very, very well. And you guys have made it possible for us to reopen.
Well, we're doing what we can out here. You know, that is pretty much an update on the EOC and what we've been doing. These were great questions that the health board did put out there for us. So yes, there's a lot that is going on. We're going to continue working together, and we're going to get through this. Okay, that's all we have today on this, and I just want to thank you all for your time, and God bless you all.
Thank you.